Hello, this is
안녕하십니까.
Dr. Kim
김정일입니다.
Jong-il. Today is
오늘은
part
combination
2 of
factor의
combination
part
factor.
2에 대해서 알아보겠습니다.
We've
우리는
already
지난번에
studied combination
combination
factor
factor에 대해서
last
알아보고
time.
거기에 대해 중요성, 오늘은
Today, I'll talk about part 2 from the fourth following the
네
last one.
번째 중요한
Fourth, the
이런
combination
combination
factor
factor는
represents the speed of
환자
movement of the
치아의
patient's
이동의
teeth.
속도를 또한 나타냅니다.
As in
우리는 이와
A,
같이
if there is a
A번처럼
high
하이
angle,
앵글이냐
that is, open bite
이런
type or
경우에
low
있어서는 다시
CF,
한번
the
얘기하면
tooth
치아
movement
이동의
is
속도가 빨리
fast.
됩니다.
On the
이에
other
반해
hand, in the
이번에
case of
볼
low
경우
angle,
low angle
deep
type,
bite,
deep bite,
and high
high
CF
CF
like
경우에
V,
있어서는
tooth
치아 이동이
movement
잘
is
안 되게
difficult.
됩니다. 그래서
If
치아 이동이
teeth
잘 안
cannot be
되는데
moved
우리가
well
소호치를
and
발치하게 되면
premolar
우리가
extraction
소호치를
treatment
발치하게
is
되면 우리가
performed,
소호치를 발치하게 되면
it
발치
may
효과를
be difficult to
맺기가
close the
어렵게 될 수
extraction
있다는 거죠.
space.
그래서
Therefore,
치아
the
이동의
speed of tooth
속도는 이와
movement
같이
is
combination
inversely
factor에
proportional to the
반비례합니다.
combination factor. A
그래서
large
combination
combination
factor가
factor
크다라고 하는
means
것은
a
치아
low
이동이 잘 안
angle type
된다는
that
것이고
makes teeth difficult
이와
to
같이
move.
combination factor가 크다라는
This is
그게
because the muscles are
정도가
very
크다라는
strong.
걸 의미하겠죠. 반면에
On
이와
the other
같이 이
hand,
combination
a
factor가
smaller
작은
combination
경우에
factor
있어서는 치아
means
이동이
faster
빨리
tooth
된다는
movement.
것을 우리는 알 수
The deep bite makes it difficult to
강력한
move
바이트
teeth due
포스
to its
때문에
strong bite
치아
force.
이동하기가 어렵게 된다라는
In
이와
this
같이 팔라탈
figure,
플랜이
the
있고
top
맨디블러
line is the
플랜이
palatal plane,
있습니다.
and the bottom
이와
line is the
같이 튜잉
mandibular
에피션시를
plane.
봤을 때
As you may
요
already know, CF is the sum of ODI and APDI.
다시 한번
When
합시다.
expressed in
그래서
terms of
그
chewing
값이
efficiency,
크냐 작냐로
it can be
표현되는
seen that low
이
CF
숫자가
or high
크다라고
angle
작다라는 걸
has a
의미하는 것이
small
함께
chewing
됩니다.
efficiency,
반면에 이와
and
같이
high
ODI와
CF or
APDI를
low
더한 값이
angle
큰
has a
하이
large
CF인
chewing
경우에 있어서는
efficiency.
로우 앵글 타입이 되게 되겠습니다. 다섯
Fifth,
번째로
the
이와 같이
combination
combination
factor
factor는
suggests the
치아가
skeletal
배열할 수
volume
있는
that the teeth can
불균적인
arrange.
볼륨을 치아가
Vertical height
이와
is
같이
basically
수직적인 어느
required to
정도의
arrange the
높이가
teeth.
기본적으로
Here's
파란색
a blue
골격과
skeleton
빨간색
and a
골격이
red
있습니다.
skeleton.
우리가 다시 한번 보면은 파란색
The blue
골격은
skeleton is the
우리가
low
로우
angle
앵글
type,
타입이 될 거고
and the red
이와
skeleton
같이
is the
빨간색
high angle
골격은 하이
type.
앵글 타입이 될 것입니다.
The
배열하려고
posterior
하려면
part
뒤에
needs some
이만큼의
space for the
공간이
teeth
있어야
to be
됩니다.
well aligned.
이런
In the red
빨간색
space,
공간에
there
있어서는
is not
치아가
enough
배열할
space for the
공간이
teeth to be
절반적으로
arranged in
이와 같이
anterior
부족할
and
수밖에 없게
posterior.
됩니다. combination
However,
factor가
the
큰
blue
경우에
space
있어서는
seems to
이와
have
같이
enough
치아가
space for the
절반
teeth to be
배열된 공간이
arranged anterior
절반적으로
and
충분하게 됩니다.
posterior. This
그래서
means that
combination
if the
factor가 큰
combination
경우에
factor is
있어서는 이와
large,
같이
there is enough
절반적으로
space to be
배열된 공간이
arranged in the
충분하기 때문에
anterior and
공간이 충분하기
posterior.
때문에 가능하면
So if
이발치로
possible,
배열할 수
it can
있다는
be
걸
arranged without extraction.
반면에
But if the
factor가 작은
combination
경우에
factor
있어서는
is small,
어딘가에
there is a
치아를 뽑아야
possibility
될
that
가능성이
you'll have
많이
to
있게 됩니다.
extract teeth somewhere.
그래서 다시 한번
Once
팔라탈
again,
플랜,
look
AB
carefully
플랜,
at this
맨디블러
triangle
플랜이
made up
이루는
of the palatal plane,
삼각형을 여러분은
IB
주의해
plane,
보셔야 되는
and
것입니다.
mandibular plane. Let's
이런
compare the
combination
combination
factor를 우리는
factor to the
아파트
size of
평수에 한번 비교를
apartments.
하도록 하겠습니다.
Usually,
아파트 평수에서는
apartments
우리가
have bedrooms and
침실이 있고
toilets.
그다음에
If a 100 square meter
평방미터인
apartment
경우에
can
있어서는
have
이와 같이
2
두 개의
bedrooms and 2
침실과 두 개의
bathrooms,
화장실이 있을 것입니다.
a 64 square meter apartment will not have enough space for 2 bedrooms and 2 bathrooms.
부족하니까 어딘가에
Therefore,
없애야
we will
되겠죠.
usually
그래서
reduce
일반적으로
one
많이
toilet
없애는 게
to
화장실
get the
하나를
proper
없앨
space
것입니다.
by subtracting one
그래서
space.
이와 같이 침실 두 개와
In other
다시 말해서
words,
combination factor
if the
큰 경우에 다시
combination
말해서
factor is
combination factor 큰
large,
경우에
there is
있어서는
enough
이와
space
같이
to
다 배열할
arrange
수가
all the
있고
teeth. And if the
combination
combination
factor가
factor is small,
이와 같이
proper tooth
어딘가에
arrangement
치아를
is
뽑을
possible
가능성이
only
있게
by
될 것입니다.
extracting some tooth. As a
우리가
graph,
X축을
when the
이런
APDI
볼
of
수가
the
있죠.
anteroposterior relationship
Y축은
is the
수직적인
axis
상태를
and the
평가합니다.
ODI
ODI로
of the
평가할 수가
vertical
있어요.
relationship is
ODI로
the
평가할 수가
axis.
있어요.
If the sum of these two values is
155보다
greater than
크면은 우리는
155,
가능하면
non-extraction
이발치로
treatment is
만들어서 해야
possible.
되겠지.
And
이거보다
if the
작은 경우에는
CF
어딘가에
is
치아를
less than
뽑아야 돼요. 이거보다 작은
155,
경우에는
somewhere
어딘가에
you
치아를
will be
뽑아야
able to
되겠지.
extract teeth. Let's look
이런
at the
부정격과
relationship between
이런
malocclusion
부정격과
and the
combination
combination
factor 한번
factor.
보겠습니다. 이와 같이
Usually, Class 3
상극과
malocclusion and
딥바이트인
deep
경우에는
bite cases have a
combination
large
factor가 크게 나오게
combination factor.
반면에
On the
이와
other
이중과
hand, in
오픈바이스는
case of
combination
Class
factor가
2
작게
malocclusion
됩니다.
and
이와
open
이중과
bite,
오픈바이스는
the combination
combination
factor
factor가 작게
is
됩니다.
small.
그래서
Therefore,
상극과
the Class 3
딥바이트인 경우에는
malocclusion
가능하면
and deep bite
비발치로
cases can be
치료를
treated
할
with
가능성이 많이
non-extraction
있겠죠.
if possible.
가능성이 많이 있겠죠.
Class
반면에
2
이중과
malocclusion and
오픈바이트에서는
open
어딘가에
bite cases may
뽑을 가능성이
result in
많이
tooth
있습니다.
extraction somewhere. However,
그런데
Tooth
치아
size is also
사이즈가 작은
important.
경우에 있어서는
Even if
그래서
the skeleton
골격이
is
작다
small,
하더라도
if the
이와
tooth
치아
size is
사이즈가
small,
작은 경우에 있어서는
non-extraction
일반적으로
treatment
배열할
may
수가
be
있게 될
possible.
수가 있습니다. 그런데
Also,
어떤
although the
환자들인 경우에
combination
있어서는 이와
factor
같이
is
컴비네이션
large,
팩터가 큽니다. 그런데
patients
이
with protruding
환자는
mouths will need
주사를
to
이미 튀어나온
extract
것이에요.
teeth.
이에
If the
반해 이
combination
환자의 경우는
factor is
컴비네이션 팩터가
140,
140으로 작습니다.
but the
안무가
patient's
크게
current
나쁘진
facial
않습니다.
profile is good,
이런
there is no
경우에는
need to
이발 치료할
extract
수밖에
teeth.
없을 것이에요.
Except
우리가
for these
필연적으로
special cases, you
문제점들이
can view
생길 수 있게
general
됩니다.
CF values and make a
즉,
treatment plan for extraction and non-extraction.
즉, 오디오가 있게
However,
됩니다.
if the CF is large and the teeth are extracted, or the CF is small and the non-extracted teeth are treated, some problems may arise.
즉,
For
ODI
example,
가져앉아
this patient has a
80,
fairly
에피디아이
large
80,
CF
80,
with
에피디아이
ODI 80,
80,
APDI 81, and combination factor
컴비네이션 팩터가
161.5.
그래서 컴비네이션 팩터가
If the
155보다
combination
큰데
factor is greater than
우리가 소고치를 뽑을
155
경우에는
and premolar
다음과 같은
extraction
문제점이
treatment
생길
is
수가 있습니다.
performed,
우리가 소고치를
the
뽑을
following
경우에는
problems may
다음과 같은
occur.
문제점이 생길 수가 있습니다.
The bite
바이트가
can be
깊어질 수가
deepened,
있고
and if the
또한
upper and
상하는
lower anterior
전체가 너무
teeth are
들어가게
too
되면
deep,
이슈인
it can
프로파일이 될 수가
become a
있습니다.
Dischitin profile. In
또한
addition,
바이트가
the collapse of the
콜랩스됨으로써
bite can lead to
하악장
crowding in
축에
the
총색이 생길
lower
수가 있게 됩니다.
anterior teeth. After
또한
treatment,
발치한
there is a
공간에서 이와 같이 공간이
possibility that the
조금
extraction
있게 됩니다.
space may become open
또한
or jaw
턱관절
joint
질환이 생길
disease may
가능성도 있게
develop.
됩니다.
This
두 번째
patient has a
경우는 이와 같이
combination
컴비네이션
factor
팩터가
of
이 환자는 작습니다.
146.5,
146.5로 작습니다.
and the combination
치료후에도 이
factor will
컴비네이션
not
팩터는 크게
change
변하지 않습니다.
significantly after treatment.
이런
What
경우에
problems could
비발치료하게
occur
되면
if this
어떤
patient
문제점이
was
생길 수가
treated with
있을까요?
non-extraction? The
전치부의
anterior bite will become difficult to
바이트를
control,
어렵게
and it will be difficult to obtain
이런
proper
조합을
occlusion.
맞추기가 쉽지 않다라는 거죠. 우리가
If
잘못
wrongly
치료하게 되면
done, the anterior
전치부도
teeth will
더욱더
protrusive
전방으로
more,
튀어나올 가능성이 많이 있게 됩니다. 또한 이런
and
경우에
patient
치료했다
may occur
하더라도
relapse after treatment or jaw
재발이
joint
되거나
disease.
아니면 턱관절 문제가 생길 가능성이 많이 있다는 것을 이
This
환자는
patient has
보시면
ODI
ODI 63,
63,
ODI 63,
APDI 71,
APDI 71,
combination
컴비네이션
factor
팩터가
134, and can be called a class 2 high angle or a class 2 open bite. This case is a difficult case.
저도 그래서
At
비발치료
first,
처음에
I also
치료했습니다.
treated these cases with non-extraction. As the patient
컴비네이션
grew,
팩터는
the combination factor increased to 138,
그런데
but still did
155가
not increase to
절대로 될 수가 없습니다.
155. And the facial profile was not particularly bad, but the open bite recurred.
재발이 되었습니다. 이때
How
어떻게
should we
치료를
treat it
해야
at this time?
이 환자의 경우
I extracted the first
상악
premolar
4번,
for the
하악의
maxilla
제1,
and the second premolar for the mandible and finished the treatment. Even after treatment, the combination factor was about 140. When the combination factor is small, you can obtain good profile and occlusion through extraction in many cases. So far, we have measured ODI, APDI, and CF to look at the patient's overall skeletal shape. That is, class 1, 2, and 3 malocclusions and spaces where teeth can be arranged. There is an additional important observation point here: posterior available space. Posterior available space has already been mentioned in the panorama analysis. This is the distance from the distal surface of the mandibular second molars to the ramus anterior border. Depending on the case, the mandibular third molar is impacted as shown in the first picture, and the posterior area of the mandible second molar is insufficient. In some cases, posterior available space is sufficient for the mandibular third molars to erupt normally. As long as the third molar tooth can be extracted and sufficient space can be obtained from the posterior part, the second molar can be moved backward. However, even if the third molar tooth is extracted, as shown in the first picture, if sufficient space cannot be obtained, the posterior movement of the mandibular second molar will be limited. To summarize the relationship between combination factor, class 1, class 2, class 3 malocclusion, and posterior available space, The posterior part is not sufficient for class 2 malocclusion, while it is a high-angle type. On the other hand, in case of low-angle type and class 3 malocclusion, the posterior part is sufficient. Therefore, in the case of high-angle type and class 2 open bite, there is possibility of premolar extraction. And in the case of low-angle type and class 3 deep bite, it would be better to extract third molar than premolar. If the combination factor is small, in order to treat non-extraction, the mandibular anterior teeth must be labiversioned or the mandibular posterior teeth must be distal movement. If the anterior teeth are labiversioned, they become unaesthetic and the mandibular posterior teeth will not move well. At this time, the mandible may rotate posteriorly and downward, resulting in more protruding facial profile. Also, orthodontic treatment in adult patients is sometimes limited. When moving the maxillary anterior teeth posterior, will it move like A or like B? Number A means that the total alveolus is remodeled when the anterior teeth of the maxilla are moved backward. And number B means that only the midroot or marginal alveolus is remodeled, but not the root. Of course, A is the most desirable condition, but it is almost impossible clinically in adults. Therefore, the sixth attempt shows the possibility of root resorption as the combination factor. You should first observe whether the patient's premaxillar thickness is thin or thick. In general, premaxilla is thin for high-angle type, open bite, and low CF, and premaxilla is thick for low-angle type, deep bite, and high CF. Therefore, it can be said that the combination factor and cortical bone thickness, symphysis, and premaxillar thickness are related to some extent. However, sometimes, as in the cases in this red line, the combination factor is 160 and anterior open bite, but the premaxilla is thin. And the combination factor is small as 146, but the premaxilla may be thick. It is better to do check it. Summarize the combination factor again. The CF of 155 or higher is high CF, and if you extract the premolar incorrectly, may deepen the bite. If possible, it is recommended to treat it with non-extraction. It is preferable to extract the second premolar than the first premolar. If the CF is 150 or less, it is a low CF, so be aware that bite open problems may occur when treated with non-extraction. And please understand that extraction of premolar or posterior teeth is necessary. Also, be careful as this is related to POP. POP will be discussed in detail later in occlusal plane analysis. In this case, the second molar tooth may be more preferable than the premolar extraction. And in the case of molar extraction, the second molar may be extracted before the eruption of the third molar. This is only possible if the eruption path of the third molar is good. The right side of this patient is in a class 1 canine relationship, and on the left side, the canine teeth of the maxilla are located in front of the canine teeth of the mandible in a full class 2 relationship. The middle of the mandible is deviated to the left. The skeleton of this patient is ODI 67, APDI 75, combination factor 142, and mandibular plane angle is 34 degrees. Could this patient's CF go from 142 to 155 after treatment? The lateral profile are protruding and the anterior overjet is large. Professor Kim, who passed away, and Professor Sato treated these skeletal patients in different ways. In other words, opinions on extraction of the premolar were different. First of all, Professor Sato's opinion is that the occlusal plane can basically change the skeletal shape. And even if the CF is 142, he thought that it is possible to change to some extent. Therefore, if the occlusal plane is adjusted in all molar occlusions, non-extraction treatment will be possible. That's why Professor Sato emphasizes non-extraction treatment even if the skeleton is small. On the other hand, the late Professor Kim believes that the occlusion can change depending on the skeletal shape. For example, if the combination factor is 142 for a patient with a small CF, it cannot be increased to 155. In some malocclusions, extraction of premolar teeth is essential. This is a lateral view of the patient just before the oral picture. Before treatment, the facial profile is protruding. You can see that the maxillary incisors are protruding and the midline is deviated. The left is full class 2 canine relationship. It is after treatment we can see a good canine relationship and good profile. This patient's pre-treatment and post-treatment CF were superimposed. The combination factor rarely changed from 142 to 140. ODI improved from 67 to 63 and APDI from 75 to 77, improving the class 2 level relationship. However, as an adult, there are limitations to some extent. You can see that the ODI has changed, the APDI has changed, but the combination factor has hardly changed. Professor Kim said, he said that in order for us to build a house, we must first accurately grasp and build the basic area and structure. This means that when we want to arrange teeth, we have to first understand the skeletal volume of the skeleton or combination factor, and then arrange the teeth. Thank you for watching.